Hello, my name is Kathleen Lisson. I'm a certified lymphedema therapist and a board certified massage therapist. We're here at my studio in San Diego. I'm the author of the Plastic Surgery Recovery Handbook, and I want to talk to you today about how you pick your surgeon and how you pick your post-op care expert for after plastic surgery, like liposuction, Brazilian butt lift, tummy tuck, mommy makeover, these type of surgeries, facelift. So what should you do? The first step, of course, is to kind of figure out what type of surgery you need, and then you will go ahead and look into the surgeons either in your area or in America, wherever you want to go for surgery. So we kind of know a little bit more clearly how to pick a surgeon than we do how to pick your post-op care expert, but they're actually really similar processes. So you want the surgeon to have a website, and you want to look at the website and see the qualifications of the surgeon. So for the baseline, if you're going to have surgery, you want to go to someone that's actually a surgeon that has been to medical school and knows how to do surgery. It's always a bonus if that person is board certified, but you need to look at, and they should have posted on their website, what their education is, what their degrees are, what their qualifications are. And it's up to you. Each individual person can decide, how important the level of education is for the surgery that they're getting. But there should definitely be open, honest communication, and the person that you hire to do the surgery should be very open and very clear about them and their name and their level of education. So where some people get into a little bit of a very interesting situation, I'm here in San Diego, but some people who go to plastic surgery outside of the town that I live in have told me that their experience is they're going to a company that provides plastic surgery, and sometimes they don't know, the name of their surgeon, or they don't meet their surgeon until the day before. So that you have to figure out if that is something you're comfortable with or not. A lot of people will want to know the specific surgeon they have, and they'll want to have that pre-op consultation with their surgeon and really feel comfortable that their surgeon knows what they want and they have a good rapport with their surgeon before they go ahead and want to have that operation with that surgeon. I personally think that for me, when I'm getting plastic surgery in the future, that's how I want my experience to be. I want to be able to go to a website, know clearly what the education of my surgeon is, what the education is, and then have that pre-op consultation and feel comfortable that the surgeon wasn't rushing me, that I actually saw the surgeon, that all my questions were answered. And then some of the questions I'm definitely going to ask have to do with recovery and how much access do I have to my surgeon after recovery. Do I get a text, do I get a phone number that I can text with questions anytime? Is the nurse going to be always available for questions? Or in the experience of other clients that we can easily find on Facebook groups, we can easily find on Instagram, other people who have been to the same plastic surgeon, in their experience, how was their post-op care? If they had any questions or concerns, did they feel like their surgeon ghosted them after the surgery? Or did they feel like they were really taken care of throughout the entire process? So that is actually a really good lead-in to how do you choose your post-op care expert, because it's, again, how comfortable you are with how much you're being taken care of through the entire process. So we need the same standards for post-op care as we would do in choosing our surgeon. I would like to see a website for every single post-op care expert. You should be able to go on their website. You should be able to see their education. You should be able to see what classes they've taken. You should be able to see how many hours of each individual class have they taken. So what I've seen is the two biggest problems that are most concerning to me is one, just like if you are going for plastic surgery, you should make sure that the person with the knife is a surgeon. I believe if you are going for lymphatic massage after surgery, you should make sure the person who you hire is a massage therapist. They should have their license or their certification in the state that they live in the city that they live in, to be able to practice massage. Now, why is this important? It's really important because they should have that level of training, and then they should have the insurance, the malpractice insurance, that if anything goes wrong with what they're doing to you, that you will be covered as a client, as the patient, that you can get reimbursed. If they harm you, they should be able to reimburse you. You should be able to have any kind of medical expenses covered. That should be absolutely what you are thinking of when you are actually going to pay money to someone to help with your care. Now, if you don't want to pay money, if this is your friend, if it's your cousin, if it's your husband, and they're giving you a massage, this is just someone that I'm having come over. It's my husband. He's doing a 10-minute massage on me. So if I get an infection, if I get sick from this massage, and I have to go to the hospital because of what happened, if they were too hard, or there was, whatever would happen after the massage, anything that would happen, if it's your friend, if it's your boyfriend, if it's your, girlfriend, whoever it is that you didn't pay, you can't expect them to do, to reimburse for the hospital bill. Because they were doing you a favor. But if you're actually paying somebody, it's coming off of your credit card, you're actually giving them cash, you should be able to be protected, because they are giving you a legal service that they're should be legally able to give you in the state and in the city. So what does this look like? We'll see on my wall right up here. This is my certification from the state of California that I am a CAMTC massage therapist. And then I have a separate certification, or this is a license from the city of San Diego that says I can practice massage therapy in the city of San Diego. So this is what you have to look for, and where this will be. The first evidence that you will see of this is on their website. So it should have their full name, it should have their picture, and it should have a link, or directly on the website, their education, the level of education they have, the number of ideally hours they have, or different certifications. So that goes to number 2, which is the certification. Some certifications are well recognized in the community, and some are not. So you can say, absolutely, if you have a city permit from the state, from the city of San Diego, if you have a CAMTC certification, there is actually a number of hours that the person has to do. There's actually some minimum requirements that they have to have in order to get that issued to them. But that does not mean that all certifications, every single piece of paper that you see on someone's wall, it doesn't mean that all certifications are equally, have these stringent minimums on them. So what have I seen? I have seen classes advertised. I have seen people open up shop, and they have taken a one-day class in which the person who was trying to teach them purported to teach them lymphatic massage and how to use several machines for people after surgery, all in just one day. And I believe that would not be a class I would take, because I know that lymphatic massage, you need more hours than just 1 or 2 hours to teach lymphatic massage. My first lymphatic massage class was 45 hours. My next lymphatic massage was 135 hours, and it included some compression. And I've taken further lymphatic massages. The lymphatic massage just on the face was an entire weekend class. And the lymphatic massage for orthopedic issues was an entire weekend class. So I would really beware of seeing someone who has a list of certifications and does not tell you how many hours it took them to earn that certification. So what does this mean? So I use this tool, and I took classes. I took 2 classes, and both were weekend classes, just to use this tool on my clients. I took cupping classes. I took several different cupping classes, and that's just to use this on my clients. I took a 12-hour class, and then I took a 15-hour in-person class, and then I took a whole weekend class that was an in-person class, and all we did was learn just how to use cups with suction. So if someone is trying to use a machine on you that has a impact inside of your body, like ultrasound, that would be something that I would really want them to be really, really well trained in, because what an ultrasound machine is doing, what these cavitation machines are supposed to be doing, is actually killing cells in your body. So you need to have a proper education, and you need to have some kind of certification, some kind of insurance that will cover you in case a client has something negative happen to them because the machine was too powerful, or the machine was used, something happened and they got hurt because of those machines that were used, because they're used right after surgery. So I would definitely want that person to be able to explain to me the number of hours of education they had, and what are some different complications in the surgery, in the use of the machine, like what goes wrong, what potentially can go wrong, and what are some of the cures for it. I would definitely want to be able to have a conversation and be comfortable with them telling me, some of the potential dangers of the machine and some of the potential side effects, and how they help mitigate those side effects. So it's the same thing with lymphatic massage. There are definitely some contraindications to lymphatic massage. There's sometimes that you cannot get lymphatic massage if you had an infection. If you had an infection, I'll send you straight to your surgeon, and then your surgeon will give you the antibiotics until it's 48 to 72 hours after the antibiotics, and they really start to work in your system. I will not give lymphatic massage to my clients. So that's just one example of when you take the proper amount of education, you know when to do the massage and when to not do the massage. So these are my tips, and I would have that same kind of conversation with the surgeon, and the same kind of conversation, that same quality that you use, the time that you take in choosing your surgeon is the same amount of time and effort that you should make in choosing the lymphatic massage therapist that will help you after surgery. So the ideal thing is to have the referral straight from the doctor, that the doctor says, hey, I work with this person, they have really great results, and then that conversation between the doctor and the therapist is there. So that's the ideal thing. But if you have to find it on your own, and your doctor does not have, or you live in a different town from your surgeon, you have to go ahead and do your due diligence with the same kind of thoughtfulness as you chose your plastic surgeon. Okay, have a good day.